as we get started here, this is our last couple of minutes. First of all, thank you for staying. It looks like we've maybe lost a couple to attrition as the morning has gone on. This will be short and sweet. So first thing is thank you guys for being here. I think this has been exciting for everybody, presenters, folks who have come from all over the state. And I think one of our hopes is that you've learned something, right? You've had an opportunity to hear about importance of detection from Dr. Koa and Dr. Bustani yesterday. Heard this morning about all the different types of management, behavioral, staging, how our community services, how you can get plugged into those, and it's a lot. It's a lot. Some of this is like drinking from a fire hose. So I hope you'll take some time to decompress a tiny bit, but then maybe go back and look at some of the flyers that you picked up, out front, and also go into the Whova app. And once they get all those slide sets uploaded, I think a lot of it has some great resources for you as you start thinking about your patients and patient care. I would like to take you back, though, to kind of where I started yesterday morning, which is the title of that talk was GMN, the right program, the right time. And of course, some of the goal of this symposium is more educational based, but some of it's also just to kind of fill you in on what GMN is, what we do, and also to show that we don't have it all figured out yet. And so that's the part where we recognize that we need the collaborations with our colleagues in primary care to make this work, because there's not enough of us to go around. And of course, part of it is how do you get folks onto that right care path? And I think that's what Georgia MemoryNet is trying to do now, getting that diagnosis, thinking about etiology, getting folks plugged in to those right resources, community services, and then getting some information back to you as the primary care physician. Of course, more importantly, I think as we move forward is, well, how do the changes within the neurodegenerative field, how does that start to change our care? Because I do say, all of us, we've gotten comfortable with how we're managing things. We recognize that it's not the most ideal way to manage, but we've gotten comfortable with it. And now we're starting to inject some things into it where now the answer is not, well, there's nothing we can do. Now their answer is, yeah, there is something probably we can do if you start early enough. And then as we move forward in the next few years, yes, our ability to detect these things is going to get better and easier. And there I'm referencing plasma biomarkers. And so there's a lot changing now, and I do recognize that on all fronts that's going to require us to adjust how we care for our patients and how we approach those patients. And our hope is that Georgia MemoryNet will be able to help out with that. Of course, now it's mainly diagnostics, get some information back to you as the primary care provider. But as I mentioned yesterday, hopefully coming soon, more resources that are available, things that we know that work in the Emory Cognitive side and in some of our other MAC partners, and making sure that those are more accessible to providers in the community. And of course, the other piece, even as we move into the future, is when we reach that prevention stage, right? Not only kind of the diagnostics of the plasma markers that are coming, but also managing just our day-to-day care of patients as they get older. And when do you do that screening test? And what do you do with those patients? And what therapies do you put them on? And that's when it becomes a game changer, right? Finding the right patients who may benefit from a therapy that could prevent something that when you ask folks, well, what's the one thing you really don't want to get? Most people, they say Alzheimer's disease. It's just, they just don't want to lose that sense of autonomy, that sense of self, that sense of dignity. And I think Dr. Bustani said it best yesterday when he showed up his kind of 3 comments. And the one that was up at the top was that concept of stigma that's associated with dementia and those diagnoses. And how do we kind of get past that? But it's that therapy part where you start early enough and you have that opportunity to intervene that I think is going to get people really excited and really hopeful. And that's what we see, and we're grateful to the state of Georgia and the legislatures for recognizing the Department of Aging Services, for recognizing that this is an important thing that needs to happen. And having this system in place, I think, will allow us to adapt as we move forward and start to use some of these new care approaches and care models. So my hope is that this is not the end of our conversation with all of you. I mean, this is kind of the beginning. This is obviously our first symposium. And the hope is that you will try to lean on us and try to use some of our expertise, start referring patients to your local Georgia Memory Nut sites, but also reach out and let us know when you feel like something is not working like it should. Because that's something where we don't know unless we know, right? You've got to let us know, and we've got boots on the ground that are checking out things, but sometimes we just don't get all those nuances that maybe there's a fax machine, which I just learned today, this weekend, that one of our fax machines at Grady wasn't working like it was supposed to, and it was going to the wrong queue, and so referrals weren't getting made. So just simple logistical stuff where, we need to know about these things so that we can keep that process moving forward as best as possible. So keep the conversation open, and I'll be happy to take any questions at this point about anything that you may have seen, any last burning questions, and then I'll let our team kind of close it out back here. Any thoughts? Last questions? Yes, ma'am.
Will we be given a start date for the Savannah?
What's that?
Can we be notified when the Savannah clinic is open?
Yes, so there will be there's going to be a press release, should be pretty soon, about the new MACs that are coming out and opening up. It should be, and I see Brian back there. I could defer to him. It should be around the beginning of October, but I don't know that we have the official start date yet. She asked about the start date for Savannah.